So do all these questions, or I mean not questions, I'm sorry, lessons that learned or observations or insights, whatever you call them, that you were able to drive or just communicated to the to entrepreneurs here or everyone who's interested in starting or possibly involved in the healthcare business. All of those insights were derived from your exposure to insurance business, et cetera. How can they be generalized in a way that, let's say, I mean, healthcare is, is very big, right?
Well, I would actually go the good news is you don't have to be in the business to get it either. I would also offer that one of my fundamental roles is to bring that which we're living today into an antiquated thing called healthcare. So, one of the things I will also, as an insight, social media hasn't worked in health. Okay, the irony is that the people that we try to protect the most are most willing to give up their privacy. Right? Those suffering from the most dire of situations are the most willing to just put their hand up and announce everything. But when the pastor opens the church, the diabetics aren't sitting in rows 1 through 4, and those with asthma in rows 5 through 8. And you don't walk up to somebody and go, "Hi, Larry, I've got asthma." In fact, I've held focus groups for 10 years where I've put 10 diabetics in a room, showed them a program about diabetes, and each one of them looks up and goes, "Not for me, because I'm not a diabetic." No, meanwhile, I know they are because I've got the claims. I've invited them to the room for that reason. And they're going, "But that guy over there, he looks like he needs it." Right? So people don't identify themselves and they don't wear a badge of their condition. Right? Now, that said, if you're suffering from a condition that pharma has not written the check towards, ALS, and I'm on the board of an ALS foundation because my college roommate passed away from it in the year 2000. ALS is a condition, patients like me was built around ALS. Those folks are desperate because pharma is not spending big money. There's not a lot of money invested in it, and therefore they will raise their hand and share every piece of information they can possibly share. So what I'm saying, go back on that question, things that we are doing in general, like with mobile, things we're doing in life and engaging with things are things that need to be brought into health. I'll give you an example and this is a kind of another lesson. Just because it's a really good idea and it makes perfect sense, don't think you're sitting on a gold mine because you haven't met a regulator yet. Okay? I once went to, I had 2 challenges, 2 things I said at United. One is, the average reading level in the United States is 5th grade. The certificates of coverage or evidence of coverage is written at the 8th grade reading level. So fundamentally, it's written so that most of America can't understand it. It's written in black and white and interpreted it's written in gray and interpreted to the black and white, right? So I said, I hired 5th grade reading teachers across America to rewrite it. You should have seen the war I had with my own legal department. And when I was finished with that one, you should have seen the battle I had with the departments of insurance. It was, I then encoded it in red, yellow, and green. Red, don't do it. Yellow, call us first. Green, you can do it anytime you want. You can't do that. What do you mean I can't do that? It makes sense. No, you can't do that. It would be an unfair advantage.
Of what?
I'm like, I'm sorry, did we not just try to help the American public? So then you try to figure out who actually is involved. So that's my other part is, remember that even though you have an idea and you think you're selling it to one audience, you may be sitting in front of somebody you think is the buyer, but there's this thing called a regulator over there too so read the regs, go meet a regulator, talk to them about it before you bring it, because if you can get that stamp of approval, you've taken care of something major.